treating migraines with Boris Cosmetic, and it's amazing.
Welcome, Phil here. He suffers from migraines, and what can we do for him, Dr. Stone?
So we're here with Phil today, and there are different kinds of headaches. So there's sort of a whole different headache sphere, and usually they're triggered by either nerves or muscles. You can have headaches, that are internal, like inside your head. That's a separate issue. We're not going to cover that. So you can have, if you have headaches that are originating outside the skull bone itself, they can either be from clenching. Some people clench their teeth and they wear out the surface of their teeth, and then they fire these muscles, so they create muscle tension headaches. Some people get headaches because the nerves are compressed, and then those nerves can either be in the front of the head or the back of the head. In this case, what Phil is telling me is that he has had problems with grinding his teeth and soreness in his jaw. If you ignore that, you'll wear out the surface of the teeth, and you can destroy these joints here, so they'll start to be loose and pop out, and then it'll get worse and worse. So the treatment for this is we Botox this muscle and these muscles, which are chewing muscles, which doesn't completely destroy ability to chew, but weakens them enough so you don't grind your teeth, and then you might not need a night guard when you go to sleep at night. The so he has two forms, that, and then he has an overlapping headache, which is from compression of the nerves. And so the nerves are, I'll draw them out for you.
Yeah.
There's one nerve that goes from there up like that. There's another nerve that goes like this. There's another nerve about there that comes out this way through the muscles. And there's another nerve about here that follows the artery up. It kind of wraps around the artery. So the way we test this is either the patient comes in and they have the headache, and then you inject the nerve and the headache goes away right away. You know that's the offending nerve. The other way to test it is to press on the nerve. So if we press on this nerve, it's a little bit of pain. If we press on this nerve, it's a lot of pain.
Yeah.
So that nerve is very sensitive. That nerve is triggering the headache. Now you can also get headaches on the back of the head. You turn around this way, and that would be usually here, where this nerve is here. You feel anything there?
It's okay.
Yeah. And this one here.
It's okay.
And then there's one here and one here. These are harder to treat. It's a more aggressive surgery. This is an easier surgery to address. So for this nerve here, when you do the surgery, we just release the muscle. We transect this nerve, we find this nerve and transect it, and then we clean up the nerves around this artery. If you don't want the surgery, then what we do is we inject Botox where these nerves are, or actually the muscles adjacent to these nerves, and then those muscles will not squeeze the nerve anymore. The nerve gets some breathing space, and then the headache goes away.
Makes sense.
This was discovered by accident. Somebody who came in to get Botox for lines, and then they came back into the doctor and said, I don't have any headaches anymore. So then they developed a whole field of plastic surgery, or a segment of plastic surgery, which deals with headaches and relief of headaches.
Well, yeah, it'd be great. I mean, look, the reality is I've been taking Tylenol like it's candy, and it's not that good for you. I've had these headaches for weeks, and so I'm really kind of at the end of my rope here.
So when you get the headache, sometimes you can't be in bright lights. You got to be in a dark room. Sometimes you get nausea.
I feel like sea legs, like I'm swaying.
Yeah, it'll affect your ability to function.
Yeah, totally.
And even though the nerve is on the outside, it's outside the skull, it originates inside the skull, and so you get sort of a delayed feedback inside, and it affects your ability to concentrate, etc.
Yeah, it's been brutal. So
the way we'll do this is we will Botox him for initially he has two headaches. He's got overlapping. He's got the tension headaches from here. He's got the headaches from the pinching of the nerve. So we're going to treat both, and we're going to start with the ones that are pinching the nerve. So those injections will be, bring our breast again, this muscle here, which crosses this nerve and squeezes it, so it'll paralyze this muscle so it won't squeeze the nerve. Relax. And you can bring it together again. You can see there's another muscle right there. So this muscle goes like that. and that's squeezing the other nerve. So we'll do this muscle, this muscle, this muscle, and this muscle. And then over here, the other one is right about there. And over here, the other one is right about there. And then we will get this muscle here, and then we'll do the jaw.
Let's get to it. Here we go.
All right, so first we're going to get this muscle here. So I'm going right into the muscle. Let me put in 2.5 units. We go right into the muscle here. Put in another 2.5 units. And I'm putting my finger here so that the injection can't drift downward. All right, then we're going to go here. We're going to put 2.5 units there for that muscle. I'm going to come right here. I'm going to put 0.5 units for that muscle. All right. Now this takes 3 days for it to fully paralyze that muscle. We've talked about doing the upper portion with Botox. Now we're going to do the portion for the, you can see he's starting to grind. You can see the muscles firing right there because he just ground his teeth a little bit. So now what we're going to do is we're going to...
And Dr. Stone, I find myself grinding a bit more when I'm stressed.
Yeah.
When I'm, you know,
that's usually what happens.
I got some stuff going on.
Or if you think about something, if you think bad thoughts, you'll grind. So we're going to get the masseter right there on each side. It inserts onto the angle of the jawbone, so here's the masseter here, right? And then we're going to get the temporalis, which is right there, which is, the jawbone is here, and then it's got a little notch here with a little piece here. This muscle goes underneath this bone here, and that pulls that, so that's part of the chewing muscle apparatus. And this one here.
How you feeling, Phil?
I feel good. Yeah, as I mentioned, I barely felt these, like nothing. As you can see, the precision, focus, the excellence displayed here is second to none. And it's what really separates good from great.
Now over here, these are very small muscles. They're like, you know, this big, that like that. This is a very big muscle.
Mm-hmm.
So you have to inject it more times to get what you need. I've got a little extra here, so we're going to get rid of his crow's feet while we're here.
Yeah, thanks.
No headaches? That make you a little bit more handsome.
Can't go wrong with that.
Now the other thing you should see once this takes effect and the headaches are resolved is his eyebrows should move up like that. Because it's the muscles that are pulling the eyebrows down that are squeezing those nerves and causing these issues.
All set, all done. How you feeling, guys?
I mean, I'm feeling great.
I feel okay.
Good.
I mean, I could, you know, honestly, slight prick one time. Other than that, I couldn't believe how quickly and how painless it was. I was just telling Dr. Stone that, you know, I'm so glad that he was able to do something like this because, you know, I know for me and a lot of people, they probably, oh, I can go to a med spa, or I can do this, you know, and it's not that serious. But these headaches are debilitating. They shut me down for days, took me away from work, my family. It's problematic. Couldn't surf, couldn't do anything. So I'm really fortunate that, you know, you're able to hit these places and do it right and not have to stress and worry. So, you know, the bottom line is you want to get something done properly, you need to go somewhere such as Boris Cosmetic and Dr. Stone to be able to help you, you know, nail these things down and not worry. And so thank you. I feel good. I'm excited for what's going to happen. I'll let you guys know how I feel. But for me, just mentally knowing that I did this properly, I feel like my, the placebo effect, right? I feel like, oh my God, I feel better already, so to speak. So I'm really excited and appreciative that, you guys offer this. I know people come here for different things, cosmetic, but this is game changing, this is life changing. So Botox to address headaches, your lockjaw, or, you grind your teeth, this is a spot. So appreciate it.
And it's FDA approved.
That's nice too, yeah.
All right.
DM or call 310-204-5822 for your free consultation to treat your migraines, headaches, lockjaw, whatever pain you're experiencing. Boris Cosmetic can help you today.